Japanese encephalitis (J) vaccine. Japanese encephalitis is a rare but serious illness caused by the Japanese encephalitis virus (JEV). It is spread to humans by infected mosquitoes. New South Wales is further expanding free access to Japanese encephalitis (J) vaccine to ensure residents living in high-risk regional areas are protected this mosquito season. The change in eligibility criteria removes the need for people living in high-risk areas to spend at least 4 hours per day outdoors and clarifies other criteria to help people assess if they can access the free vaccine. This change in eligibility criteria is being made in New South Wales and Victoria. In addition to the current group of people who work with pigs or mosquitoes or in specialised laboratories, Communicable Diseases Network Australia's CDNA national priority groups and some international travellers. The vaccine is now also recommended for people aged 2 months or older who live or routinely work in any of the high-risk local government areas and regularly spend time outdoors, placing them at risk of mosquito bites, or are experiencing homelessness or are living in conditions with limited mosquito protection, e.g. tents, caravans, dwellings with no insect screens, or are engaging in outdoor flood recovery cleanup efforts, including repeated professional or volunteer deployments. The vaccine is available through local general practitioners, GPs, Aboriginal health services and pharmacists. People who meet the above criteria should make an appointment ahead of time and let them know it is for the vaccine. These providers may require a few days' notice so they can order the vaccine. Kira Glasgow, New South Wales Health Director of One Health, urged eligible community members to book in with their healthcare provider and get vaccinated against JE. Now is a great time to vaccinate, not just because we're in the midst of mosquito season but because the eligibility criteria are now expanded to include a much broader group within affected regional areas, Ms. Glasgow said. However, it's important the community continues to stay vigilant and take precautions against mosquito bites altogether because, aside from Japanese encephalitis, mosquitoes carry a range of viruses for which there are no vaccines. People in New South Wales are urged to take action to prevent mosquito bites to protect against mosquito-borne viruses. Protect yourself and your family by wearing light, loose-fitting long-sleeved shirts, long pants and covered footwear and socks, especially around dusk and dawn. Applying repellent to all areas of exposed skin, using repellents that contain DEET, picaridin, or oil of lemon eucalyptus. Reapplying repellent regularly, particularly after swimming, being sure to always apply sunscreen first and then apply repellent. Using insecticide sprays, vapor dispensing units and mosquito coils to repel mosquitoes. Mosquito coils should only be used outside. Covering openings such as windows and doors with insect screens and checking there are no gaps in them. Removing items that might collect water, such as old tires, empty pots, outside your house where mosquitoes can breed. Improving drainage on your property so that water does not become stagnant. Do all mosquitoes carry and transmit Japanese encephalitis virus? While Culex species of mosquitoes are most likely to be carrying the virus in New South Wales, mosquitoes are hard to identify and may also carry other viruses such as Ross River, Barmah Forest and, rarely, the virus that causes Murray Valley encephalitis, so it is important to protect yourself against all mosquitoes. Why is Japanese encephalitis in New South Wales now? Before this year, Japanese encephalitis virus had rarely been found in Australia, with previous cases noted only in Northern Australia, Cape York and the Torres Strait. It is not known how Japanese encephalitis virus came into mainland Australia, but the movement of infected mosquitoes or migratory water birds may have played a part in the virus spread, combined with significant rain events. Japanese encephalitis virus has now been detected in pigs and humans in western and southern New South Wales, as well as in Queensland, Victoria, the Northern Territory and South Australia. Is meat from infected animals safe to eat? Animals can be infected with the Japanese encephalitis virus, but they cannot transmit the virus to humans. It cannot be transmitted by touching or eating meat from an infected animal. Can the mosquitoes in my backyard carry the Japanese encephalitis virus? Not all mosquitoes in New South Wales carry the Japanese encephalitis virus, but some do carry JEV as well as other diseases such as Barmah Forest, Ross River and more rarely, the virus that causes Murray Valley encephalitis. The best thing you can do is take steps to prevent being bitten. All important link will be posted on description.